This is a special edition of Late Night Health. I'm Mark Alyn. We're going to take a look at what has been called an epidemic in addiction. We're going to take a look at the treatment facility called Paradigm Treatment Centers and Solutions here in Southern California. Our guest is Dustin Wagner. He has a master's degree and he is the chief operating officer of Paradigm. Dustin, thanks for spending some time with me.
Yeah, thanks, Mark. Nice to meet you, and thanks for having me.
Uh, am I right? Is there a problem right now that's at epidemic proportions with all kinds of addictions, particularly drugs? And as we come out of the pandemic, we see that, being cloistered for a year and a half has affected us mentally.
Yeah, it sure has. I mean, and yeah, it's definitely we are definitely reeling from the effects of the last year and a half of battling COVID and isolation and all of the side effects of that. So yeah, I'm excited to talk about that with you.
Who's been affected? I know that I think teenagers are one, but parents as well, adults?
Yeah, I mean, I think we specialize in the treatment of teens struggling with mental health, and so and when you work with teens, you work with parents, the family as a whole system, and so we're definitely seeing that teenagers and parents are just have really been knocked sideways over the past year and a half.
Uh, you specialized. Well, tell us about Paradigm itself. You
Yes.
specialize in working with teens primarily.
Yeah, so we offer residential treatment. So clients come to us and stay with us on campus for between 5 to 8 weeks, and we specialize in mental health treatment. So we really focus on treating depression, anxiety, suicidal ideation, screen addiction, substance use. I mean, the things that teenagers struggle with right now is just pretty wild, and so we really try and treat the person as a whole human, and so we come at it things from helping teens really learn how to deal with their emotions.
Did you say screen addiction?
Well, let's talk about COVID and talk about all these teenagers having to spend the last year not only just on social media but also on school and dealing with their education and just trying to feel some sort of connection through these devices. So we've definitely seen a big uptick in social media use, screen time, and just the negative cycle that's created.
One of the things that I find interesting is my wife and I, even before COVID, we'd go to a restaurant and we'd look at a couple, and they'd be a young couple, maybe in their early 20s, sitting in a restaurant eating, but they were both,
Yeah,
with their
they're
phones. I'm reaching for my phone. They're both on their phone, and I really want to know if they're just texting each other or if they're waiting. I mean, it just
yeah.
it's amazing. I was at a convention. Two women are sitting in a booth. There's nobody in their booth. They're both sitting there on their phones, and they were in their very early 20s. And I walked over to them and I said, "Why aren't you out in the aisle, maybe having people come in to buy whatever it is that you're selling?" Is this something that young people, younger than even you, are kind of conditioned to do?
Yeah, I think it's really become an automatic response. I mean, we don't know how to deal when we're not stimulated or we're bored. And that's a lot. I mean, that's a lot of what we do. So, to clarify, we work with teenagers ages 12 to 17, and then we also have a young adult program that we work with folks from 18 to 26 years old. And the thing that's common across the board is that people more now than ever are not really capable of managing their feelings, and especially if you're not constantly distracted or have something in your hand that is taking your attention, you there's feelings that we're all carrying around, and people don't know. I mean, that's really what we specialize in, is like, how do you get in touch with that thing that you're feeling, that you've been carrying around all day, all week, all month, all year. And because yeah, the social media, phones, all of it, it's all it's doing is just stuffing those things farther down. So, and it's going to come out one way or another, and that's where we step in, and we deal with the folks where that perpetuates anxiety and stress and trauma and all of that.
I would also think that it creates a new paradigm, and to use your name, of interaction with people, not being able to do so person to person.
Yeah.
And that would
Yeah.
be,
I mean, something that we've seen even just in the last, 5-8 years is that we're dealing with clients and teenagers and young adults that they're just kind of missing some of the social interaction. I think everybody's much more comfortable now kind of putting out that perfect self into the internet and social media, like, here's who I want to be. But then there's a real disconnect of like, but this is how I actually am and who I am. And I think it could be it's for sure it's a helpful tool. It's fun and it's exciting, and I know there's some real good use for it, but it has also, I mean, I'll go a little deeper, but something that I think is important to share is that we recently did just kind of an internal survey with our clients, and just kind of wanted to get a real good sense of where people are at with their phone use, social media. And something there was a lot of things that we found that were really interesting, but the thing that really surprised me is that the clients that we work with, and this is something we did a month ago, they're aware that it has a negative impact, that
oh,
they jump on because they're hoping to feel better. They use it for however long they use it, and at the end they feel worse, and they know it, but they keep going back to it. And that, there's no better definition of addiction than that.
it's like going back for more cocaine or more.
Yeah.
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 You're a young guy yourself, okay?
Thanks.
So I'm got to ask. I mean, I know you're not addicted to screen time, but come on, you're a gamer, aren't you?
I'm not afraid. I'm not afraid to play some games. And I grew up when video games. Video games have been around a long time, but yeah, I love to play games. And for a few different reasons, though, I'm not. I don't think there's anything wrong with social media, and I'm glad when people are using it and they're using it in a healthy way. But I'm not on social media. I think I have a LinkedIn account, but and partially it's because of the work that I do. I'm already on my phone enough, and I I just I think I've been afraid to even open that door because I know what it leads to. So
Right. Well, I'm on social media, but I ignore it a lot.
hmm
I just, somebody say, hey, I sent you they'll call me.
hmm
And with something called a telephone,
hmm
and they'll say, I sent you a joke, or I sent you something for work on Facebook or LinkedIn. And I don't follow it every day. It's just not part of my personal paradigm. By the way, if you want information on the paradigm treatment, we have their website up throughout our interview right now, so you can see that. Uh, I'm curious though. You also offer. You mentioned mental illness and suicide. We know that suicide amongst teens has skyrocketed. Is there a reason for that?
Yeah, I mean, certainly. I think we're dealing with a real crisis of kind of an overall disconnection and hopelessness. And I think people are feeling less and less authentically connected. And I think while we are putting a lot of effort into managing our social media selves, I think there's a real there's a real gap. And kind of going back to what I was saying earlier, right? I think we have gotten into this crisis where we're having a really hard time managing our feelings and managing our ability to ask for help or to alert people. Here's what I'm thinking. Here's what I'm struggling with. And so, yeah, what we do at Paradigm is, for the course of treatment, which minimum stay is 35 days. Is we're doing individual therapy every day. We're doing family therapy multiple times a day or multiple times a week. Group therapy. We're getting outside. We're having fun. There's a psychiatric piece. We have a full-time psychiatrist that looks at things from the medical side, and we have nursing. We look at diet, nutrition, all of it, and an education component. So what we're really trying to do here is just kind of pull people back into being a whole human being. And so, but yeah, suicide has increased. And something that's really interesting of all the things that have happened during the pandemic, really alarming, that I think there's been like a 30% increase of young people that are going to the ER for the first time to deal with a mental health crisis. And so there's been a real lack of in-person mental health counseling. We've got this whole telecare thing and video, but we are getting farther and farther away from that in-person, kind of person-to-person, face-to-face treatment.
And your phone went off, my phone went off during our interview. We live on these things. It's become part of society, but I guess there's a healthy respect. We both turned ours off. I know people who would stop the interview and say, hey, Mark, hold on a second, or, Dustin, give me a minute here. I think that's important to note that, these are useful tools.
Absolutely.
But to a point, right?
And so, so is social media. I mean, it's all useful. There's a lot of content. There's important educational thing, news and just entertainment, art. I mean, there's a lot of funny stuff. And sometimes I do kick myself that I'm not on, but I think, I think that it's a little out of control. And I've definitely seen it just even in my time working in this field and working primarily with young people, it has perpetuated our mental health crisis. Absolutely.
Right. What kind of mental health? I mean, I can see, I guess anxiety would be one.
There's a real cycle that happens where I think whatever's going on in someone's life, if they're living in fear, if they're not sleeping, not able to perform, not, just social interaction is difficult, then anxiety increases, and that takes energy, and it increases, and it just kind of pings all day. And then you run out of energy and you crash, and then that can turn into a depression. And then there's just a real perpetual cycle of this anxiety, depression pattern. And so, yeah, I think, and that can be hard to name. It can be hard to name. It can be hard to admit. And I think definitely in a family system at home with parents, it can be hard to, we're all trying to look and perform our best. And because the dynamics, and that's why we do the family therapy, is there may not be a real obvious, comfortable opportunity to share with, someone's mom or dad, like, hey, I'm struggling. And so that's what I think is great about our program, is that not only are you taking a break from your phone, and part of our treatment is like, let's learn how to use these phones in a way that's going to help you, not hurt you, but also how do we talk about it as a family? How do we, giving parents support, skills, and how to, open the door and have real good, honest, authentic conversations.
You use behavior modification. Is that the primary treatment?
Yeah, that's a great question. No, we don't.
No.
We don't. I think I've worked in that, and I think that's great. We're really kind of working with our typical client is someone that's anxious, depressed, has negative self beliefs, and and on a real honest level wants some help. And so we're not having to, we're not having to like reward or offer consequences or making people do chores or anything like that. We're really kind of trying to connect to people, connecting with that internal motivation, not external. And so we're treating clients the same way day one as we do at the end of their treatment. And so our job is to create an environment where people are able to be perfect. We really want to kind of know what's going on, and it's in that ability for someone to open up that they can really kind of get into that scary. It's hard work, it's scary work, and that's our job is to kind of help them get there.
Are you developing new techniques, new treatment options?
I think we will use anything that helps people learn how to better manage their feelings. And so we've got some folks that are getting trained in some cool stuff. There's modalities that have been around for a long time, but I think the thing that probably makes us unique in that I know we haven't created it, but we're trying to perfect it is we want to have an environment where people feel physically safe, which is a given, but emotionally safe. And then our job is to support our clinicians, our staff, in being able to kind of, this is like this living, breathing organism. And so our job is to keep it moving forward. And if we can kind of create an environment where people feel safe in all the ways they need to feel safe, then naturally they're going to start doing that work as we offer skills and we're, pointing out these negative patterns that they have. And I think for me, our work is to get somebody where they're able to kind of name what's going on. They're feeling safe. They're connecting with their peers, doing some good group work. And then the most important part of it is like bringing the family in. And so we really try and we pride ourselves on our family work and the family therapy that we offer, because we don't want people just to function well with us. They need to be able to take that home with them.
So that's what sets you apart. One of the things that sets you apart is the family therapy aspect.
I think it's the most important piece. We don't fix people. That would be great if we did, or if we had like the magic thing or the pill or whatever. But we're just trying to kind of pull people back together and helping parents be able to kind of continue that momentum when they go home.
And we've been talking about mental illness, but at the same time, do you also treat drug addictions? Because those also have mental illness components.
Yeah. We work with a lot of teens that are depressed, anxious, and they're maybe using marijuana or they've gotten into alcohol and it's becoming a problem. So we definitely treat that. I think we're really the program for someone that is depressed, anxious, has some trauma, or is maybe coming to terms with their sexuality or gender identity, and really kind of in a phase of transition in their life. We work really well with those folks, and in that we see, some of the side effects is, these are teens that are maybe self-harming or starting to use or increase their use of drugs and alcohol. They're isolating, they're addicted to their social media. We do great with that. That's our specialty. I think for the folks that have really heavy drug use and maybe using opiates and just hallucinogens and all of that, and really kind of need more like addiction treatment, that's not really our wheelhouse. But we know some great programs that we can refer to.
Right. And at the same time, after they've gone through the drug treatment, they need to come to you.
Yeah, come here.
Right.
Yeah, we're here for you.
Got it. Yep. In our remaining time, when should parents say, my kid has a problem.
Mhm.
What are 2 or 3 signals that parents should look for so that they can get them into a treatment center such as Paradigm?
Sure. Yeah. Well, before I answer that, something that I think is really important, is whenever this has been my experience. Whenever there's a teen that we get that's coming into treatment for us, and maybe they're here for depression or self harm or combination of all those things. Parents are like, well, this has been going on for 6 months, and then we get to the teen and we get them acclimated to the program, and start doing our assessments. We find that it's much longer, and that they've been struggling for much longer. It's worse than people know. There's things that are going on that people don't know about. These our teenagers, they're smart kids, and they're good, and they can wear that mask, so I just that's something that I say to parents. It's better to. That's been something I've learned, is that it's often worse than it seems. So I think the thing that is important for parents is kind of watching out for someone's ability to just manage daily living. And if someone's having a hard time getting out of bed, or just not sleeping, or not functioning, and not even just with grades, but just overall kind of engagement in life, I think. And certainly if just clearly unable to manage emotions. And listen, one of the unfortunate criteria of being a teenager is that your emotions aren't always stable. That's just how that goes. Hormones play a role in all of that. But I think someone's inability to really kind of be able to contain, communicate, manage their emotions, and it's resulting in things that are unsafe, that's a time to get some serious help.
Dustin, I really appreciate your spending some time with us. If you want
Yeah.
information about the program, we have the phone number, the 800 number, 877-883-1223, as well as the website, which is paradigmtreatment.com. It's been up throughout the entire interview. Dustin, thank you very much. Look forward to another conversation with you.
Likewise, Mark. Thank you. Talk to you soon.
Okay. Thank you. Bye-bye. I'm Mark Alyn. This is Late Night Health.